So, which medications do you keep when you go home on hospice, and which ones do you get rid of? This is actually a really personal question, and there's not a one size fits all answer. The reason why I say that is going home on hospice has different circumstances in different situations. So, let me explain. And the best way to explain is likely to give a couple of scenarios. For example, if someone is going home on hospice and they have a stage 4 cancer diagnosis and they know they don't want any more treatment or any more workup for their cancer, but they potentially have weeks, months, or even longer to live, then this really means that when they're going home on hospice, we actually can continue most of their home medications. Now, there is some nuance because the hospice agency typically pays for the medications. So if you're on a medication that's super expensive, they actually might either stop that medication or trade it for an alternative that's a similar medication. But things like insulin, diabetic medications in general, high blood pressure medication, blood thinners, all of these things can be continued when you're going home on hospice typically. Because if you're on a blood thinner and you have a stroke while you're on hospice because we were not thinning your blood and you have chronic AFib, then that's not aiding you in your comfort. Same with sugar. If you have really high sugars, really low sugars, you're a brittle diabetic, and we stop all of your diabetic medications, you're going to be miserable. So there's a lot of ways to go about continuing your normal medications if you have a little bit of a longer prognosis on hospice. On the flip side, in an alternate scenario, if we think that someone is going home on hospice and is very likely to pass away in the next couple of days or maybe in the next week or two, then usually we'll recommend discontinuing their medications, other than medications that are very specific to aiding them in their comfort. That is because a lot of times they can't even take their medications anymore, or we know that they're imminently dying, and if their sugar goes high or low, it really may not change their comfort or quality of life. This really does make it easier on the patient and their family toward the very, very end of life. So this is why this becomes a difficult situation. There's not a perfect answer. And a lot of times in palliative, I suggest kind of cutting back the things that aren't aiding in comfort. So what do I mean by that? So one is like a cholesterol medicine. And if we're not working on, preventing cardiovascular disease for the future, then we probably don't really need the statin anymore. So usually we'll stop those. Vitamins are another example. A lot of times I am just like, hey, we can get rid of your vitamins at this point to decrease your pill burden. But if somebody really loves their vitamin D, then by all means, they can continue it. So sometimes those will have to be paid for out of pocket, and hospice won't necessarily cover those. But if that's something that someone wants to continue, they absolutely can continue those.